Make word combinations using a word from each box. Look at A and B opposite to help you. Blood stain, breath sounds, little rope, productive cough, vocal resonance. To write the questions using words that are better known to patients. Look at A opposite to help you. Number one, is your cough productive? Did you cough up any phlegm? It is a loose cough. Number two, what color is the sputum? Sputum. What color is the phlegm? Number three, it is ever purulent. It is ever yellow. Number four, have you ever had jamoptosis? Have you ever noticed any blood in it? Number five, do you suffer from dyspnea? Any problems any problems with your breathing? Are the following statements true or false? Use your medical knowledge and A and B opposite to help you. Number one, a patient who has a loose cough produce phlegm. True. Number two, Frankles are heard when the airways are narrowed. False. Number three, a patient who has a non-productive cough produces a sputum. False. Number four, wheezes are typical of pleurisy. False. Number five, a pleural rope is a sign of asthma. False. Complete the description of herpes zoster shingles by replacing the medical words in the brackets with ordinary English words. Look at A and B opposite to help you. Number one, shingles, herpes zoster usually start with pain and soreness. The red spots macules appear that develop into groups of small blisters, vesicles, over a particular area on one side of the body. In most patients, new spots lesions continue to appear for 3 to 5 days. The small blisters, vesicles, become filled with pus, pustular, and then form scabs, crusts. In severe cases, there may be scars, cicatrices afterwards. Read the description of the rash of rubeola and complete the notes. Look at A and B opposite to help you. The spots are scattered pink macules which appear first behind the ears and on the forehead. The rash spreads rapidly first to the trunk and then to the limbs. Location and distribution. First behind the ears and on the forehead, then the trunk. Grouping, scattered. Type of lesion, macules, color, pink. Complete the notes for the rash in the photograph and suggest a diagnosis. Look at A and B opposite to help you. Location and distribution, widespread on the chest and abdomen. Grouping, scattered. Type of lesion, small macules with some scales. Color, pink. The diagnosis, Glutathione psoriasis. Complete the notes for the lesion in the photograph and to get a diagnosis. Look at A and B opposite to help you. Location and distribution. Below lateral angle of the left eye. Grouping, single. Type of lesion, nodule. Color, right, pink. Diagnosis, basal cell carcinoma. Write the corresponding medical terms for the ordinary English words and say what kind of force is involved. Look at A opposite to help you. Common word, breeze. Medical term, contusion. Type of force, blunt. Cut, incise, wound. Sharp, graze. Abrasion, blunt. Scratch, linear abrasion. Blunt. Stab, wound. Penetrative wound. Sharp. Tear, laceration. Blunt. Choose the correct words to complete the description of the injuries shown in the illustration. Look at A and B opposite to help you. There are grazes above the left eyebrow and on the left side of the neck. A contusion to the left side of the lower lip and tears to the left cheek. Write a description of the injuries shown in the illustration. Look at A and B opposite and at the 32.2 above to help you. There is a laceration of the left shoulder and an incised wound. A cut approximately 6 centimeters in the leg above to the left nipple. Complete the sentences. Look at A, B, and C opposite to help you. Number 1, frequent changes of position are necessary in the immobile patient to prevent the development of a pressure sore. Number 2, he had several stab wounds in the abdomen from the knife. Number 3, he was knocked unconscious by a heavy blow to the head. Number 4, the wounds were only superficial and required no treatment. Look at the conversation in A opposite and complete the notes about Mr. Jones. Use medical terms where possible. CO, frequency and nocturia for 1 year. NO, dysuria or hesitancy, stream a little weaker. No incontinence apart from occasional breathing. Match the patient's description of their symptoms 1 to 7 with the medical terms A to G. Look at A opposite to help you. Number 1, I have to pee every half hour or so. Letter B, frequency. Number 2, I get a scalding pain when I pass water. Letter A, dysuria. Number 3, I have to get up several times to pass water at night. Letter E, nocturia. Number 4, I have to rush to go to the toilet. Letter F, urgency. Number 5, I have trouble getting started. Letter D, hesitancy. Number 6, I can't hold my water. Letter G, incontinence. Number 7, I pass some blood in my urine. Letter C, hematuria. Write the doctor's question for each of the symptoms in 33.2 above. Look at A opposite to help you. You will need to think of your own question of urgency. Frequency. How often do you pass urine? Dysuria. Do you get any burning or pain when you pass water? Nocturia. Do you have to get up at night? Hesitancy. Do you have any trouble getting started? Incontinence. Do you ever lose control of your bladder? Hematuria. Have you ever passed blood in your urine? Urgency. Do you have to hurry to get to the toilet in time? Right. The doctor's question for each of the symptoms in 33.2 above. Look at A opposite to help you. You will need to think of your own question of urgency. Urgency. Frequency. How often do you pass urine? Dysuria. Do you get any burning or pain when you pass water? Nocturia. Do you have to get up at night? Hesitancy. Do you have any trouble getting started? Incontinence. Do you ever lose control of your bladder? Hematuria. Have you ever passed blood in your urine? Urgency. Do you have to hurry to get to the toilet in time? A doctor is talking to a patient during an ophthalmoscopy. MASH, the underlying expression she uses 1 to 4, two expressions with similar meanings from A opposite, A to D. Right, Mr. Gold, because you've been having these headaches, I'm going to have a look at your eyes, particularly the back of your eye, the retina. I'm going to put a couple of drops in your eye, which will make it easier for me to see the retina. After a few minutes, you may find your vision a bit blurry. This will wear off after about an hour. I need to get rid of as much external light as possible. This means closing the blinds. Now, I would like you to look straight ahead at that clock. This takes a few minutes and your eyes might feel a bit tired, so you can blink if you need to. I don't want you to look at me. Look at the clock. A. The examination is done with dim light. It refers to number 3. B. A topical mydriatic solution corresponds to number 1. C. To aid dilation corresponds to number 2. D. Fixate on a target. It corresponds to number 4. Complete the instructions. Look at the opposite to help you. Number 1. Wrap the cuff around the patient's upper arm. Number 2. Place the diaphragm over the area of the bronchial artery. Raise the patient's arm so that the bronchial artery is at the same height as the heart. Number 3. Close the valve on the pump. Number 4. Pump out the pressure to at least 150 mmHg. Open the valve a little and slowly deflate the cuff while listening and watching the pressure gauge. Number 5. The first sound you hear is the flow of blood through the bronchial artery. The value on the gauge at that point is the systolic blood pressure. Number 6. Continue listening while you slowly deflate the cuff Number 7. The diastolic blood pressure is measured when the sound completely disappears. Complete the test. Look at the opposite to help you. Phlebotomists are specially trained in taking blood. They are skilled at venipuncture, puncturing the vein to take a blood sample. The wrist, hand, and foot can be used, but more often the vein in the inner part of the elbow is used. If it is difficult to locate a suitable vein, the patient may be asked to make a fist, or a tourniquet may be applied on the upper arm to make the vein more apparent. Afterwards, a dressing is applied and the patient is asked to press gently. This helps to stop the bleeding and prevent bruising at the site. It is important that specimen tubes are labeled correctly before they are sent to the hematology laboratory, where a full count or other investigations will be carried out.